Okay, so hi, I'm Travis again. Just want to talk about today in this video, cash case fees for spinal decompression, return on investment, things like that. ROI is pretty simple. In the past, we used to recommend lower case fees for decompression, and we're not, dogmatic on, charge this amount or charge much more than that. We kind of leave it up to the doctor, and we give you our opinions. And it seems as though, we want to get chiropractors to make what you're worth, and you're delivering life-changing results to patients that have really bad disc problems that maybe can't walk well. They have leg pain all the time. They can't work well. They have pain driving to where, we give you great certainty with the technique courses. That's a true patient for decompression. And what's that going to cost? So this has always been a question doctors ask us all the time. As a cash-based service, how it's most effective is that you couple spinal decompression with general adjusting techniques when indicated by the doctors seeing necessary, effective physiotherapy modalities such as class 4 laser for pain relief and healing, and say electrotherapy for inflammation reduction, things like that as well. Proper nutrition is also important, which is a balm dose of curcumin and chondroitin, which can greatly target discogenic pain by inflammation reduction. And rehabilitation. So rehabilitation is big. So if you're not including that in decompression protocol, you really should think about it, because that's going to give you long-term satisfaction and outcomes by the patient. So if you just do decompression, which may or may not be indicated there, most of the time, obviously, it is for putting them on a table. They may come back in your office a month or 2 months later with the same or worse back or leg pain. And if you've taken $5,000 from that patient, it's not always a good referral source. But if you can treat that patient and get them the results and give them the longevity of the lasting results, they tend to refer more often and refer more new patients to your office. So my opinion is, I think if you value decompression as a case fee less than $3,000, and pricing is important. If you don't put not a high value, but if you don't put a value on it, patients don't think it works. They don't value it as anything that's really good. So I tend to like $3,000. We do teach $5,000, but it comes down to your choice essentially, what you need to make ends meet in your area of the neck of the woods there. So that really is boiling down to 12 to 20 visits. And like I said, we recommend you add rehabilitation to that at least after the 12th visit when the patient is able to. We really prefer the KDT form closure belt for stabilization. So if rehabilitation is tough or you find that positive form closure, which leads to more muscular or more facet, something non-discal, it's a pretty good solution, at least for the patient, to limit that pain and stabilize the spine during decompression care so they can wear that during daily activities so it doesn't give them pain or they can't screw themselves up worse. So you can give them that belt and do your bird dogs, your side planks, your Trendelenburgs, all these different rehab exercises that will stabilize the core, which will give you that long-term results you're looking for. So as far as ROI reimbursement, our KDT NeuroFlex system now is $12,000 plus shipping. So if you just do a couple of patients, you pay for your table at $3,000. So the ROI is kind of a no-brainer. So just wanted to talk a little bit about that today, as far as our view, our experiences, what we see. But if you're charging, less than $1,000 for decompression, it really doesn't seem to go well with patients anywhere in the United States. So just wanted to give you your insight. Thank you.